includes strength training, balance training, and stretching. These can be tailored to each patient based on their specific needs and abilities. For example, a patient has a difficulty with arm movements might focus on arm exercises, which includes the strengthening and stretching of the muscles including the arm. Whereas a patient who has a balance coordination difficulties might work on single leg exercises, core stability, which improves the balance. So by adjusting the intensity and type of exercises, therapists can ensure the program fits each patient's recovery level and goals. Physiotherapists have the power of inspire and empower patients to reach their full potential power. Example like I myself have divided the post-recovery of the patients into 6 categories, which is very simple. First, set clear and achievable goals. Break them down into smaller steps and celebrate those milestones of their achievements. And second one will be the offer engagement and praise. It includes like acknowledge the patient effort and progress, no matter how small the activities or the achievements by the patient. So third will be the make exercises enjoyable and relevant. Relevant in the sense like connect them to the daily activities which help or incorporate patients' interests and hobbies. And fourth will be the educate the patient, which is very key role because the patient should not get bored or why the physiotherapist is asking us to do this activity. Here we have to educate the patient on how each activity aids recovery and help them to understand, to prepare and their benefits. Whereas the fifth involves family members, rehabilitation process, encourage support and involvement. Family members plays a key role in getting off the post-stroke recovery because the small emotional attachments to the patients help him to come out from the depressive stage, and encouragement from the family members will help them to come out of their weakness. So here when the physiotherapist is trying to explain the few things, small activities can be again practiced by the family members, by the patient. This goal will help them to achieve their progress very easily and the progression will be in a lesser time period. Whereas the reminds or sixth category will be the remind patients of their progress. Highlight improvements on success of the patients which they have achieved in their progression of the treatment. For example, if you given a pegboard for a patient and ask him to keep 3 colors, if he has achieved in keeping the 2 colors in the proper holes, encourage it. Help him to improve in the third pegboard. So in this way, it will help the patient to improve the physical activity after the post-stroke. So integrating sports and physical activities in the stroke recovery plans enhance physical, cognitive and emotional well-being. Whereas physical benefits includes improve mobility and balance, enhance strength and flexibility, better coordination, reduce spasticity and muscle tone. Whereas the cognitive benefits improves memory and concentration, enhance problem solving skills, good or better mood regulations, reduce stress and anxiety, increase self-esteem. Whereas emotional benefits gives you social interactions and community engagement, motivation, build the confidence, fun activities to develop or reduce the stress. So these activities include the stroke patients to help them to recover. Sports have long been a source of motivation, perseverance and teamwork. We can apply the same principle to help stroke patients overcome their challenges, like a team effort between patient and healthcare professional. In this healthcare professional, it may be a treating or primary doctor, physiotherapist and the caregiver. Caregiver is like who is being with or helping him in their daily basic needs and all. And that second will be the patient and the family members. together form a team and help in recovery of the patient. Celebrating small wins like encouraging to do as I explained before, like pegboards, and giving targets to achieve as a patient is able to perform, celebrate it to a build and up confidence. We can withdraw some stories of athletes or recently happened the Paralympic athletes who has overcome incredible setbacks. Their stories, their achievements might also help in motivating and help the stroke people to recover and come out of their discomfort levels.